The kidney channel is the yin-yang pair channel of bladder channel. It's also the foot channel of Shaoyin. Let's start with the primary channel. The kidney primary channel starts beneath the little toe, crossing kidney 1 at the sole of the foot. The channel emerges at kidney 2 and goes to kidney 3, posterior to the medial malleolus. It circles around and goes to kidney 6, inferior to the medial malleolus. Then it goes up along the medial aspect of the leg. It crosses the spleen channel at spleen 6 and goes to kidney 10 at the medial side of the popliteal fossa. It goes up along the posterior medial aspect of the thigh to the tip of the coccyx, intersecting with the governing vessel at GV1. It goes through the spine, enters the kidney and bladder. There is a branch from the kidney that goes to the liver, passes diaphragm, and enters the lung. It goes along the throat and ends at the root of the tongue. Another branch from the lung joins the heart, linking with the pericardium at CV17. The primary channel comes out at the upper border of pubic symphysis, 0.5 chun lateral to the midline at kidney 11. It goes up intersecting with CV3, 4, and 7. It follows the 0.5 chun line until kidney 21, then goes to 2 chun lateral to the midline. It continues to go up along the 2 chun line and ends at kidney 27, inferior to the clavicle. The kidney luo-connecting channel starts at kidney 4, posterior to the medial malleolus, and connects with the bladder channel. It goes up along the primary channel to below of pericardium and goes into the lumbar spine. The kidney divergent channel comes out at the popliteal fossa. It follows the bladder divergent channel and connects with the kidney. It crosses the girdling vessel in the region of the second lumbar spine, then goes to the root of the tongue and emerges at the nape of the neck, converging with bladder primary channel. The kidney sinew channel starts beneath the little toe. It joins the spleen sinew channel inferior to the medial malleolus and binds at the heel where it joins the bladder sinew channel. It goes up the leg and binds at the medial condyle of the tibia and at the genitals. It goes internally and goes up along the inner aspect of the spine to the nape of the neck, binding to the occipital bone and converging with the bladder sinew channel. Here are the key points. The primary channel and sinew channel begin beneath the little toe. The primary channel intersects the spleen channel at spleen 6. The primary channel and luo-connecting channel go to the lumbar spine. The sinew channel goes to the inner aspect of the spine and occipital bone. The divergent channel and sinew channel go to the nape of the neck. The primary channel and divergent channel go to the root of the tongue. The sinew channel binds at the genital. The primary channel enters kidney, bladder, liver, lung, and heart. The luo-connecting channel goes below pericardium. The divergent channel enters kidney. Now let's look at signs and symptoms. The kidney primary channel manifests pain in the lower back, pain in the sole of the foot. The kidney luo-connecting channel has excess and deficiency syndrome. For excess, signs and symptoms include mental restlessness, depression, retention of urine, pain in the heart region, and distension and fullness of the chest. For deficiency, there is lower back pain. Signs and symptoms of the kidney sinew channel are pain, stiffness, and sprain of the toes, foot, inner ankle, stiffness of the spine and neck, inability to bend forward and backward, convulsions. Now let's go over some major acupuncture points on this channel. Kidney 1 is good at treating liver yang rising, liver fire, and liver wind due to its action of descending axis from the head. These patterns are excess above and deficiency below, causing signs and symptoms such as headache, dizziness, and vision problems. Along the same line, this point can harmonize the heart and kidney, treating mental and emotional problems. As the kidney channel goes to the throat and the root of the tongue, kidney 1 is also known to treat signs and symptoms such as throat painful obstruction, inability to swallow, and loss of voice. Kidney 1 is also indicated for shortness of breath or coughing due to kidney deficiency and running piglet chi. Kidney 2 has a prominent action of clearing kidney yin deficiency heat, causing signs and symptoms such as dry throat, night sweating. But at the same time, it also has a tonifying yang action. So Moxibustion on this point can treat yang deficiency with spontaneous sweating, cold extremities, diarrhea, and edema. Kidney 6 is a major point for treating the sore throat, whether deficient or excess. This point is also indicated for both insomnia and somnolence, and it regulates the lower burner, treating disorders of the genital urinary system as well as any kind of constipation. Kidney 7 regulates the water passages. It can treat any type of edema. It can induce or stop sweating, and it can also stop the bleeding, such as blood in the urine or stool and uterine bleeding. Kidney 8 is also the major point for the uterine bleeding problems. It can treat uterine bleeding due to both kidney deficiency and excess, such as damp heat or blood stasis. These 2 points are located very close to each other. Kidney 10 treats the excess patterns of the genital urinary disorders. It treats signs and symptoms such as uterine bleeding, leukorrhea, genital itching, and difficult or urgent urination by clearing damp heat in the lower burner. If you want to learn more about acupuncture prescriptions according to patterns, please check our blog. The link is in the description. In the next video, we'll learn about the pericardium channel of hand Shaoyin.